So welcome everybody to a THR Champion webinar. So we have myself, Jessica Perkins from thr.net, Dr. Dilon Human also from thr.net, and we have a very special guest, Dr. Abbas Raza from Pakistan, who is a consultant physician, and he'll introduce himself in a minute. Thank you very much for joining us today, Abbas, and for giving us your time. So Abbas will discuss the important work that he's doing in the areas of diabetes and also tobacco control in terms of improving health outcomes for tobacco users in Pakistan. So would you mind, Abbas, introducing yourself and why you chose the area of medicine that you're working in?
Thank you, Jessica, for a very nice introduction. And again, I think today's webinar is on one of the most important topics that we are working on these days. I'm originally from Pakistan, and again, I started my career from Pakistan as going to the medical school. Then I switched gears and I went to US for completing my internal medicine residency, and then I did my fellowship and research in endocrine metabolism and diabetes. And I think that's kind of where we started looking at the metabolic effects of diabetes and modifiable risk factors for where we can actually make a big impact by creating an awareness among people. So that's where currently I'm working in Pakistan. I work in two hospitals. One of them is Shaukat Khanum Cancer Hospital and Research Center. The other one is a private hospital, and I had the opportunity to serve as a president of Pakistan Endocrine Society. From there, I served as president of South Asian Federation of Endocrine Societies, which is 7 countries. And currently, I'm the president of International Society of Endocrinology, where I serve as a president as well.
So what does your normal day-to-day look like? So you're a clinician, and what other things do you do in your day?
So Jessica, in a usual day, how I would work is I do a lot of clinical work at the 2 hospitals that I work in. I'm part of few research projects, so that's the second component of is in the complications. So again, just to give you a background, I've been part of coming up with guidelines related to diabetes management in this part of the world. We've been part of writing guidelines for use of the sulfonylureas, medication in diabetes, and number of other things that we deal as far as a day-to-day. So I again work as someone who can coordinate things between different societies. So we recently published metabicity guidelines in which we talked about metabolic disorders associated with obesity, and we got together people, the 7 countries that are in the region, which is Pakistan, India, and all those other regional countries, to come up with some guidelines in helping people realize the effects of metabolism and obesity. And I work as a clinician as well as someone who is an advocate for different processes, different disease processes which are affecting this part of the world.
And we heard that perfectly. Thank you, Abbas. That sounds really interesting. I'm going to move on now to talk about the report that you recently co-authored titled Integrating Harm Reduction into Tobacco Control, where the report delved into the number of lives that could be saved by accelerating tobacco control policies in Kazakhstan, Pakistan, South Africa, and Bangladesh. The report highlighted the issue of the still very high numbers of premature deaths from tobacco use each year in these 4 low middle income countries. The methodology used modeling techniques that considered prospective data under various scenarios and considered the effect of tobacco harm reduction uptake by those countries. So tobacco harm reduction uptake is relating to early cancer diagnosis and treatment, and a high availability of alternative, safer products than cigarettes. So for Pakistan specifically, Abbas, what do you think are the key messages or the highlights of that report?
So Jessica, it's important for us to realize that tobacco use is universal. And again, we in this part of the world are as affected as any other part. But unfortunately, the impact of disease in this part of the world could be even worse than other parts. And the reason I tell you is that the overall awareness and the impact awareness among the people who can make the policies are much significantly lower as compared to what you look at the other part. Just looking at the 4 countries we studies, we looked at and we found out that we can prevent. There are premature deaths associated with smoking in this part, which amounts up to 350,000 deaths. Premature deaths associated with it, and there's a lot to be done accordingly. And I usually say smoking is 3 component. One is realizing smoking is bad. The other part is making from the institution and the government level, making steps which can reduce the smoking burden, or encourage people to stop smoking. And the third part is, which is more important, is the effects of smoking to be diagnosed early. And again, I'm not talking only about the microvascular, macrovascular complications seen in diabetes who smoke. I'm also talking about the incidence of lung cancer, which a number of people die from it. So I think the 3-prong approach, if we look at it, and we kind of looked at what impact can be done if we take the right measures, which include talking about smoking cessation, which we are already doing. We can reduce the deaths from approximately 160,000 to probably reduce it by 40% if we just raise the awareness among the people in the next 20 to 30 years. We are going to reduce it. But the second most important part is giving alternatives or providing safe ways to quit smoking, which is burning tobacco. That can further reduce the risk of death and lung cancer by about 60% from where we're starting today in next 20 years. And along with it, better awareness about the lung cancer and the complication of lung cancers and early detection of lung cancer can further reduce it to about 20%. So if we work all together, which is based on this the report that you will see, that if we work together in a way, and we try to reduce the burden of deaths related to tobacco, we need to work on all 3 fronts as well. Awareness to reduce tobacco use. Second part is getting the alternatives so that people don't die from it, who are actually using tobacco right now. And the third important part is the awareness about the lung cancer and early screening of it. And just to give you an example of what I mean by doing, say, just if you look at the current levels, there are about 8 million people who die from tobacco use as a cause of tobacco use. This number is not declining tomorrow. We are going to go up to 10 million plus deaths in a year before it starts declining. And the only way we can help people to quit smoking and early detect the cancer risks associated with it is to bring up awareness, bring up the alternatives of how to quit smoking, and to give people a safer ways as compared to burning tobacco, smoking tobacco, to a better way of quitting smoking or reducing the impact of tobacco side effects to these individuals.
Thank you, Abbas. You mentioned that one of the things that needs to be done is raising awareness amongst people. In Pakistan specifically, how do you think that can be done at the simplest and the quickest level, or the quickest way?
So Jessica, another valid question and a very important question for this part of the world, because what we have traditionally done is just to raise the awareness about, we're trying to raise the awareness about tobacco abuse. But on the other hand, you see a lot of younger generation and people who already smoke are unable to quit smoking because they don't have an healthier alternatives or a less harmful alternatives to smoking. Unfortunately, that's where the gap is. And again, I just want to quote you some of the examples which are also published in this report as well. The countries who have given better alternatives for smoking, and people who are trying to smoke or who are current smokers have had a better impact on overall use of tobacco, as well as outcome-based complication of tobacco as well. Probably if you look at Sweden, you can get a better example. You can look at Japan, you can get an example in which people were giving alternatives for quitting smoking, who were using tobacco in the form of cigarettes. By giving them alternatives, they were not only able to quit easily, reduce the harm of tobacco easily, but also had a lesser chance of complication. We know if we use the alternatives for tobacco abuse, and on top of it, the toxins which are produced are much less. Till the time we can get a society which is totally tobacco abuse free, we'll have to go through those measures. And I think awareness has to start from the bad effects of tobacco abuse. The second step is giving them healthier alternatives, and then probably down the road helping them quit smoking, and not being even exposed to the effects of it.
Thank you. Delon, did you have a question?
Abbas, yes, thank you. Thank you for your terrific insights and the important work in Pakistan, which could act as a role model for many of the low middle income countries, not only in Asia, but also in Africa. But I'm tickled by your day-to-day work, where you see many patients with diabetes, and many of them smoke as well. How do you connect the dots between what you do for internal medicine generally, and then also for patients with diabetes who smoke? Do you think there are any specific measures that can be taken to help them?
So, Delon, a very pertinent question. And again, as before we came up with this road, we've been working for the last few years on looking at, and again, I know we've been working together on a project which is looking at the complication of diabetes and smoking together. And just to give you some perspective, which is probably more local than anything else, and probably in the low socioeconomic, it's more common, is the existence of double burden of disease in this part of the world. And double burden means people who have diabetes have a higher incidence of infectious diseases as well, including the TB. And again, the combination, the triad of smoking, TB, and diabetes could just be the wrong combination for this part of the world. So in day to day, I'm dealing with people who have diabetes, have a higher risk of TB, and then they're burning tobacco and smoking cigarettes, which puts me at a greater higher. And I think that's one of the areas that we need to definitely look into. What are the consequences of that, and how can we help prevent this complication, this vicious cycle of developing complication related to tobacco use, and having a double burden of infectious diseases in the lung, which are very common in this part of the world as compared to the Western world. And this is very typical scenario for this part.
Yes, it's the so-called polychronic disease, and the burden of disease in especially Pakistan is vast. So we thank you for your work in all of those areas. I think when we spoke about the awareness, it's also more important perhaps for physicians to understand the principle that you elucidated to, which is doctors all want their patients to stop smoking cigarettes. But we know that in such a few cases, it's possible for them to stop. And many of them don't want to stop. And you mentioned that the importance is to show that there are alternative routes. In Japan, it's heated tobacco. In Sweden, it's been oral tobacco and oral nicotine pouches. So you made the point very clearly that the alternative routes should be shown to patients by their doctors. How can we better reach physicians, make them aware of the alternatives, and show what the evidence base is for those alternative routes?
I think, Delon, the important part is it's what you the in a day-to-day clinical practice, and again in our society, in a lower social economic term, people tend not to spend too much time talking about the smoking, tobacco use, even in the diabetes clinic. We did a survey in this part of the world in which most of the people were never talked regarding their smoking if this status during the clinical practices, which is important to know. The reason being, if you don't talk about it, how can you stop preventing it? And I think a journal campaign regarding smoking and alternatives of how to quit smoking is important. We always talk about smoking. So these campaigns are seen by the patients in their private homes. when they come to the clinic, they don't discuss about it, number one, and they don't know the alternatives, how to reduce the harm on it. So I think the public awareness of how to reduce the harm of smoking will do a lot of good work, so that people can come and talk to the physician. And again, in general practice, we need to make sure that people at least are asked about if they're using tobacco or not, and in what form of tobacco they're
Yes.
using, so that harm reduction could be talked about as well. So it's a multi-pronged problem which needs to be dealt in a multi-pronged. There's a time limitation, commitment limitation. We know this is one of the major modifiable risk factor in diabetes. I'm an endocrinologist. I deal with diabetes and I see the complication of diabetes. And this is one of the single most important modifiable disease risk factor that we can change. Unfortunately, we don't have options how to give the alternatives, and we don't talk about how to quit and help them quit.
Abbas, just a personal question. You have a busy life. You have clinical medicine. You do a lot of media work as well, but you're in good shape. So the question is, are you a good cricketer? What do you do in your spare time?
So again, it's all about keeping the balance, and I thank you very much for the compliment. I really appreciate it.
Right.
But it's the matter of honestly, if you look at in anyone's life, it's about the balance in whatever you're doing. And I honestly think at the end of the day, when we are preaching our patient what to do, we deep down have to believe in what we are preaching as well. Otherwise, it does not reflect, and people can pick it up very easily. So I think it's about making sure that you not only practice what you're saying, but also try to at least put your full effort and have a belief in what you're saying. As I'm talking to you, probably my reflection of about how to reduce the tobacco harm is reflecting, because I deep down I really believe in that there should be ways that we should be able to help our patients to reduce the risk of smoking and give them better alternatives. And actually that's coming from the heart, because that's one of the most important problems that I see in this part of the world.
Thank you very much, Abbas.
Can I give one last question?
Yeah.
For 2024, Abbas, I would love to know, on a professional level and personal, what goals do you have? What would you plan to accomplish this year?
So again, one of the things that I'm right now working is I'm again, as I mentioned in the beginning of the interview, I'm currently holding a position of International Society of Endocrinology, and I think as a personal goal for me, there are a lot of good things. There's a lot of information that could be shared, not only about the disease processes, but also how to prevent the disease in itself. Again, smoking is in my agenda. Good lifestyle, and again, and again, obesity is in my agenda for the next 1 year. So I'm looking forward to at least I can contribute and give back something to the society and a global society of because at the end of the day, we are all one part. We are all living in the same world, and again, I think we need to contribute in whatever way we could.
Absolutely. What a pleasure. Thank you very
Abbas,
much.
thank you so much for your time.
Thank you.
Thank you for your sharing your wisdom and talent. Thank you very much.
Yes, we'd like to talk to you
Thank you,
again,
Dana.
perhaps later on in the year.
Thank you.
Thank you so
Okay.
much, Abbas. Take care.
Perfect.
Thank you,
Bye-bye.
Abbas.
Bye-bye.
Bye.